Gentlemen, welcome back. We are joined right now by Senator Ron Johnson, Republican from the great state of Wisconsin. Hey, Senator, thank you for joining us.
Hey, Steve. How you doing?
I am fine. Good to talk to you again. I was most intrigued by your proposal because we've been playing almost nonstop. If you like your health care, you can keep it. No one's going to take it away from you. Not now, not ever. And, of course, that's just one of the many lies or misrepresentations made by the president. So talk about the if you like your health care plan, you could keep it act.
Well, you are right. I always consider the two big promises President Obama made during the health care debate was if you have a family plan by the end of his first term, the cost of it will actually decrease by $2,500 per family per year. And if you like your health care plan, you can keep it, period. Like no questions asked, no doubt about it. And, of course, we're seeing that promise being broken and violated thousands of times. Actually, there's over 1 million people already that have received notice that their health care plan they currently have will end come January 1st, and they're going to be forced to try and access health care on the disastrous website called Obamacare.com.
I think it's healthcare.gov, if I'm not mistaken.
But what's unfortunate about this is I can't protect every American with this bill because short of repeal, that's the only way President Obama can actually honor that promise. So, what Americans need to understand is that the president was one of two things: either totally dishonest with the American public when he made that promise, or he was just frighteningly ignorant and had no clue what was actually in his health care bill, or didn't realize the consequences of what was Obamacare. Just didn't understand it because there's no way with the passage of this bill that every American would be able to keep their health care plan if they like it. There's just simply no way whatsoever.
All right, let me ask you, sir. By the way, we just had liberal cartoonist Ted Rall on, and he is blasting Obama and the whole thing. And he said he's now paying $610 a month. He's going to have to pay $830. His deductible is $2,500. It'll be $3,500, and they're paying 80%. They'll only pay 50% of his costs after that. So he's getting screwed along with everybody. But for time, I want to go to this next question, sir. Chris Ruddy, CEO and founder of Newsmax, my boss, who we'll have on at the top of the next hour, wrote a column last week, and I think he spurred on a tidal wave of similar response from and then it won't be that much of an issue in 2014 because the full effect of the chaos won't be felt by the voters. So where do you fall on that?
Well, first of all, I think the default position will be that this thing is going to be implemented and it will be a disaster, and that's exactly what's going to happen. I do think there's a certain responsibility for us to limit the damage. And let me just talk about this. If you like your health care plan, you can keep it act. Because what really prompted me to pull the trigger on this thing now, we've been thinking about this. We've been trying to figure out how to go about doing this. But we had a couple in Wisconsin, both with cancer, and they were on the high risk pool insurance, paying about $600 or $767 per month for their coverage. They appreciate the coverage. It was working really well. They got the notice that their coverage ends on January 1st. The husband has tried almost 50 times to replace that plan. What he's getting, and the only information he's getting, he's starting to contact the insurance companies directly. The bottom line is his cost of coverage will probably double.
Wow.
Now, with government subsidies, his costs may remain somewhat similar in terms of his own out-of-pocket, but the American taxpayer will have to pick up the doubling in cost of his health care because of Obamacare. So there you see a violation, a breaking of those two promises. He's not able to keep his health care. And by the way, here are two individuals with cancer. Adding stress to being ill is not a good thing. And then the cost of their coverage will basically double. And of course, President Obama said if the cost of a family plan would decline by $2,500.
Yeah.
So I mean, that is just what disaster Obamacare is going to be to our healthcare system, to people's lives, to our federal budget, to personal freedom is just incalculable.
So what's the next step here in the Senate? Do you have a lot of support? Is there any bipartisan support?
Well, we're probably going to introduce the bill later this week. We just got the legislative language, just kind of worked that out. And right now, I'm going to be casting about for Democratic co-sponsors. I'll first start with the 10 Democrat senators that are at least recognizing that if people can't buy the insurance, you probably shouldn't fine them. I mean, I have to admit that's just sort of a basic tenet of fairness right there. If they can't buy coverage, how can you tax? It's not a penalty anymore, Steve. It's a tax.
Right.
You can't tax them for not being able to buy health care. So those 10 Democrat senators that at least are willing to be fair-minded enough to say we probably ought to delay that individual mandate, maybe they'll also be fair-minded enough to say that we'll help President Obama honor at least this promise to a certain percentage of Americans and let them keep their health care, not experience a doubling of their costs.
All right, Senator, kudos to you and good luck with it, and we'll keep abreast of how it's doing. Thank you.
Have a great day.
You too. Take care. Senator Ron Johnson, ladies and gentlemen, a Republican from Wisconsin. If you like your health care plan, you could keep your health care plan. Or should I say if you like your health care plan, you could keep your health care plan act, which will be hopefully introduced in the Senate later this week. We'll keep an eye on that. When we come back, the founder and CEO of Newsmax Media, Chris Ruddy, as I said, he started a whole new conversation with his column last week about what the Republicans should do in keeping the implementation of Obamacare on schedule. We'll talk about it with him on the Steve Malzberg Show, Newsmax TV.